Advantage Health Africa. What is it about, really? What gave rise to it?
So back then, I noticed some gaps in the sector, and I think from a system perspective,
How long ago was this? 10 years?
2017, no,
2017. Okay, 6 years ago. Okay.
So I think about systems. I think about systematic approach to things. Being a CPT,
Okay.
and so I saw that the pharma sector in healthcare was underperforming. There was glaring gaps in access. We just thought, or I thought with my team then, that is a simple case of diffusion. Let's move medication from the area of higher concentration to a region of lower concentration, and use tech, use networks, and use logistics to get it happen. And that was what we set out to do in 2017. In retail, I certainly want millions of people to know with assurance that all you need to get medication that is genuine, that is affordable, is to go on any of our platforms for My Medicines, My Advantage, or My Care Plus. The whole point is to look around diseases, to look around access issues, and look around demographics and find what can I do that would help a simple man on the road to understand that he can now have access to genuine medication, have access to tele-consultation, and have access to on-demand diagnostic care. And all of that outside of the wall of the traditional hospital, because the facilities are just overwhelmed with numbers. If we can do that, then we can scale healthcare in Nigeria and in Africa. The very first approach we had was to say, look, this demand is huge. One entity cannot solve it. In fact, we needed to be asset light, as most entrepreneurs realize. So if you go the asset heavy route, to have your own warehouse, pile up drugs and all of that, you might end up just, sabotaging your journey. So we needed to collaborate and form partnerships with 1,000 pharmacies. And what we sought to have then was to have the inventory of those pharmacies, to then aggregate that inventory as our collective inventory. That had never been done in Nigeria. Now we're taking that further. We're no longer just relying on their inventory. We're now enabling them with software to help them do better. Performance improvement goal that we want is that the inventory across the country that is sitting in the pharmacies, they need to move faster. So we have software now that we're releasing, and we're creating that acceleration. We have some pharmacies that we've contributed as much as 10 million naira of revenue to their pharmacy per year. Everybody could just walk to the pharmacy and pick up their medicines. Unfortunately, there's a problem.
Right.
The problem is you can get up to 2-3 pharmacies and you can't fill your prescription.
Right.
And that's the reality. So what we've done in aggregating inventory is to save you that. And so it's a convenient solution. But it's also a solution that assures you that it will not increase and jack up the price. So the customer gets it at the same price he or she would get it if he was to walk to the pharmacy.
That's
so
amazing.
We're not jacking up prices. So the ecosystem suffers from a dearth of professionals staying within. They just want to leave. And I helped to build this one, and we run it as a CSR or together with the regulator. If we're able during the internship period to catch the attention of the pharmacist, to begin to think of themselves as solutions providers, they're more likely to stay within the profession or stay within the country because they've identified what they can do to bridge the gap. This year, we got in 28 non-Nigerians to sign on. What we do is we expose them to an area of knowledge that you don't readily get in school. I think every day we get feedback that this is wonderful and working for them. First, when we started it as a franchise, we had almost 60 pharmacists join, and we helped to rebrand, retune, and so many other things. Okay. So now we've grown a growth hub, something called My Pharmacy Growth Hub.
Okay.
We still do manage some pharmacies, and some still have the franchise in Edo State, in Lagos State, and so on.
Okay.
But what the pharmacies now get from us are 3 streams of resource or skills growth.
Okay.
They build up their structure, they build up their systems, and then they build up their sales optimization. There are all sorts of things happening in the growth hub, and surprisingly, it's still free. Beyond My Medicines, beyond a unitization or a statutization of medication cover called My Advantage. So we created a community as a service where instead of you paying for a lot of cover for things you don't need, you simply pay for medication and telemedicine for a month. That way we've broken down or statutized healthcare so it's more affordable at the grassroots. Another we're doing now is for non-communicable diseases. So we created something called My Care Plus.
Okay.
It's like a patient concierge service. The increase in prices of drugs has been crazy.
Of course.
But with My Care Plus, once you subscribe, your drug prices are stabilized for that period. First question is my people. That's my superpower. I'm really blessed with people who see the vision and run with it as if they own it. The second is we want to keep expanding care at the last mile. So when you keep doing last mile healthcare, opportunities keep opening up. We also have products that it's ours exclusively to market. We want to roll those across Africa. On Instagram, I'm active, Abimbola_Adebaki.
Okay.
I also started a YouTube channel.
Very much, Abimbola. It's been amazing having this chat with you right here on Fudelity SME Forum. Thank you.